Awesome. All right, everyone. Hello, and welcome to another episode of Logicon's podcast interviews. Today, we have, of course, a very special guest, Cecilio Murillo, and he is the System VP, Ambulatory Access Strategy and Operations at CommonSpirit Health. And as much as I would like to give a more detailed introduction, I think it would be best to hear from the man himself. But Cecilia, if you'd like to tell a little bit about yourself, your background, and we would love to take the audience would love to know more about you.
Sure. Appreciate the invite, Murad. Thank you very much for having me. So, Cecilio Murillo, I serve as our System VP of Ambulatory Access Strategy and Operations for CommonSpirit Health. And fun fact that we are the third largest healthcare system within the US and the largest not-for-profit. So, with that comes the daunting task of making sure that we're able to provide timely access to care for our patients. And coming from a nonprofit operations background, a background in making sure that everything that we do has the lens of how do we serve the patient the right time when they are looking for care, when they need the care, and truly looking at the fact that when we have them calling us, when they're contacting us, that's our one opportunity to make sure that we're taking care of the whole patient. I may be calling today for my cold, my flu symptoms, but have I talked to that patient about their blood pressure? Have I talked to that patient about their diabetic conditions? Those are those times where we really have the opportunity to make sure, can we take care of the whole patient? So one of the things that we're really focused on, I'm really passionate about, is making sure that we can take care of the patient the first time that we interact with them.
Absolutely. Excellent. Excellent. Cecilio, thank you so much. That was a really nice way to present it out. And for the audience, I definitely like to mention I met Cecilio at Dreamforce, and the talk that he had about Common Spirit Health and its vision and its mission was something that really excited me personally. As at Logicon, what we do in the healthcare space is very much aligned to the mission towards better patient health, better patient care, especially when it comes to speeding up the process of getting care quickly towards the patient in as much as of a human-centric fashion too, but always involving the right layers of automation that Common Spirit is also focused on. And from that, I would love to ask Cecilia to talk a little bit about the One Connect platform, which was the very interesting topic that we had over there. Just a brief intro about what its main functionality is, what the objective behind it is, and how is it going so far for you guys?
Sure. Gosh, well, One Connect was born out of the idea that we, as CommonSpirit Health, came together with a myriad of electronic health record systems. As the organization began to grow and form, we realized we had about 26 different source systems, whether that be an electronic health record system, practice management system. And so often what that meant was we had what we call our patient connection center team members who would handle all calls, whether they be administrative or clinical in nature, having people sift through and search through multiple systems. I I don't exaggerate when I say that each team member would have as many as 8 source systems on their screen, whether that be their reference sheets, their knowledge articles, in addition to the EHRs. And so the idea of leveraging Health Cloud, Salesforce's Health Cloud, was to create this overlay that would allow us to integrate multiple EHRs instances. And to be clear, every build, you can have the major EHRs, but each build is different. So regardless, I have to enter into 2, 3, 4 different instances of an EHR. So now I'm potentially working in one system, talking to a patient from another system, and hoping that I don't make the mistake of registering them for the wrong area. It's a lot. So
Yeah.
when we decided to leverage Health Cloud, we really looked at how can we integrate the systems through a middle layer of MuleSoft, but then create the workflows and the configurable workflows, booking guidelines, tee everything up for the staff member so that there is no subjectivity. We want to be able to provide the hard stops. When you think about, you start with the layperson, I'm not going to have the clinical knowledge, nor should I make any clinical judgment on a patient's symptoms or reason for call. But as soon as we start going through yes, no scenarios, yes, no questions, and we reach that hard stop of, ooh, this is something you need to talk to a nurse. Now we're able to confidently transition that call to the right level of care. In most cases, now what we've seen is we've escalated more calls to nurse triage clinical resources than we had before. And not because we didn't want to back then, but these hard stops really make sure that we provide the right level of care at the right time for our patients without delay.
Excellent, excellent. I think that's a very well defined mechanism of what the core objective behind this mission is. And I remember from Dreamforce, as you mentioned that currently, you may correct me on the numbers, but you mentioned around 5 million calls per year. Is that the number that you guys are doing right now? That's excellent. And given that you also mentioned that from you had a conversion rate of about 66%, and that ramped up to 90%, which is pretty remarkable. How would you talk about this journey more specifically in angles where you had the biggest challenges around interoperability solutions? Because I understand how these different EHRs and multiple healthcare systems can have big conflicts among them, especially with large data silos that exist. So, what were some of the biggest challenges, and how were you and your team able to overcome to achieve these ranking up numbers?
Yeah. I think when it comes to interoperability, you really think about all of the different sources, different resources, and the time it takes to touch each one of those. When we were able to bring everything to one, for lack of a better term, a single pane of glass view for our staff members, we're actually able to have them know the patient just as they were known by the front desk person when they came into the clinic. They were able to understand through the CTI integration, hey, am I talking to Cecilio, or is Cecilio calling in for his son today? I,
Mm,
I know those things right away. Being able to see past histories, the full patient 360. Was this patient just admitted to the hospital or discharged? Is that what they're calling about right now?
mm,
Are they looking for their, again, like I mentioned earlier, they're calling for their flu, but hey, did you know that you are due for your Medicare annual wellness visit? Let's make sure that we schedule that for you today. All of those things that just a year ago for us, we just had our 1 year anniversary of going live with this system. These were things that unfortunately we couldn't get to because I would have to look somewhere else. Again, not that our people didn't want to, but they didn't have the tools available to them.
mm,
Everything connected and brought to to raised to their
mm,
screen to say, this is the next best action.
mm,
Don't forget to bring this up to this patient. Again, how do we close those care gaps? How do we ensure that this is not just a one call and we'll hope that they come back to us for the next thing? Can we take care of all of your needs now that I have more time to talk to you? Because a lot of the things that we also look at is cycle time, staffing plans. We've actually found that we've been able to, through the interconnectedness now of these systems, we're actually saving time. Our
mm.
calls have reduced, 90% of our calls we aim to keep within 6 minutes, not because we want people to get off the phone fast, but because me as a consumer, I don't have time to be on the phone for that long. Can I just get through everything that I need, answer my questions, and move on?
Right.
We've been able to see more care gaps closed, the placement with the right patient visit. So you brought up the example in one of our medical groups where we actually found that we were only able to book 66% of the time an appointment when and where the patient needed it. We actually found that we created a lot of these rules and preferences that actually blocked our ability to provide the patient with a sooner appointment,
Mm,
and thus fill rates were lower. So as we start to look at this data, which we didn't have before, of when you have this rule for this slot with this provider,
Mm.
yeah, you're not going to fill that slot. So we went from 66% in September, no, I apologize, in November of 2023 to May. We were actually able to reduce the median time to new patient appointment in this medical group from 62 days to
Hmm.
26 days. No
Nice.
additional providers, no additional extended schedules, like for like view, and we were able to reduce that time to next available. When you think about the criticalness of a patient who is leveraging the emergency department as their primary care, or because they can't get in and establish care with a primary care doctor, a specialist going back and telling you, hey, go see your PCP for this or that, that that's critical. That's the human impact that we hope to be able to achieve.
Yeah,
Right.
as they say, data is king. So, like, did you deploy any tools to go through this data trend, or like, how did you guys spot this? Like, like, how did you spot this from the data or the
So,
trend that this is what's happening and we need to reduce the rules?
it's the things that we had no idea that we should have been tracking all along. The the ability to get this data was probably always there, but it wasn't
Hmm.
simple, because now you're talking about, do we go and pull it out of the EHR? Do we pull it out of the practice management system? How do we overlay it? This this was simple, which was so
Hmm.
astonishing for us. It was very simple because it was case data. In
Hmm.
Health
Hmm.
Cloud, you have a case. You spoke to the patient. Yes or no, did I achieve the outcome of that case? The patient wanted to schedule an appointment. Did you schedule it? Yes or no? The
Hmm.
fact that we had something as simple as that, which is
Hmm.
just, it's probably frustrating, more frustrating that we didn't have this sooner. The simple fact that we had this many calls, we had this many appointments, and this many times we scheduled it the first time, we could actually drill down now to the market, to the medical group, to the office, to the provider, to be able to say, this provider, I can schedule 90% of the time. But with this provider, I can only schedule 50% of the time. We may find that that provider is actually the one that we need to ramp up, that they're trying to build their practice. How do we set up these preferences to make sure that we guide patients to where we have the ability to grow and support the community? We certainly don't want to have
Hmm.
a brand new clinic in a brand new market or a brand new neighborhood and it's sitting empty, where we can say, if you're willing to drive, and again, let the consumer decide. If you're willing to
Yeah.
drive 5 minutes in the other direction, I have a primary care provider over here for you that
Hmm.
can be seen.
Right.
Those
Hmm.
rules about alternates, that being able to
Hmm.
say, I want to see Dr. Smith first. If Dr. Smith's not available, Dr. Martinez is next. And if Dr. Martinez is not available, here's a pod of 10 alternate providers within the medical group.
Right.
You can be that broad or more specific. But again, going back to those rules that we create for
Hmm.
ourselves in healthcare, where we say, gosh, why did we even make this rule?
Yeah, absolutely. And firstly, definite a big congrats on the 1 year anniversary of the product. That's always something special. And with all the implementations that is being currently done at Common Spirit Health and with One Connect, how difficult or challenging do you see uh, private practices to be involved in what you're doing, like in terms of not only integrations but having them on board with the objective behind One Connect. So are private practices a challenge while doing this?
I think with CommonSpirit Health, obviously, we have a network of affiliated providers. And I think the biggest challenge for private practices is obviously the ability to be able to support at a broader scale and be able to attach to the right systems and make sure that when their patients go to a hospital, are they getting those records back timely? When the private practice primary care provider needs to send their patient to the cardiologist, to the orthopedist, how can they get their information back in a timely manner, in a complete manner? So I do feel that our ability to leverage this myriad of systems through this single pane of glass will actually allow us to better support the community by being able to send back the right data, which we're doing, but in a much faster manner. The ability to automate some of those redundant tasks, to be able to give more time back to the human, give more time back to our team members, to spend time, the quality time with our patients, with our community providers, really educating our patients of what resources exist for them by taking the, again, redundant steps out of their workflow.
Excellent, excellent. Very nicely put. And at Dreamforce, you mentioned about the AI enhancement that you are in the roadmap and in the process of implementing with CommonSpirit. So, what is the overall goal behind this, and what is the immediate next steps that you guys are taking, where AI involvement is, of course, in contributing more towards this better patient care element you guys are focused on?
I think a lot of it is being able to provide a safety net for our care team members, but also our patients. Being able to ensure that it's not an additional click in order to find
Yeah,
that care gap, but that pop-up that says, do
this is
not
the care
to
gap.
tell
Yeah,
this patient about this.
yeah.
Um, Again, back to the, we're not done. 5 million calls. We are certainly not done supporting all of the practices across our ministry. We still have ways to grow, but obviously, how do we grow with a shortage in the labor force?
Mm.
Or how do we grow with the competing priorities across our system? We want to be able to do this in a way where we actually can take the joy and put it back into healthcare. Be able to have me spend time speaking with the patient that's calling without the stress of, oh, but we have how many hundreds of calls in queue?
Hmm.
Be able to take the repeatable, redundant steps, tee them up, make sure that our consumers are getting the support that they need the way they need it.
Hmm.
We were in the process of revamping our consumer digital experience as well. How do we enhance all of our touch points with our patients?
Right. While keeping the administrative work as less as possible, because of course
Right.
the biggest challenge with the labor force is sky high. I think that's the main challenge that every silo in the healthcare industry has to face. Yeah, that.
Right. There's a lot of burnout. We want to make sure that we're able to bring that joy back to the frontline team
Mhm.
member, that
Right.
they're able to feel connected to the work and really be a memorable person in
Yeah.
somebody's care journey. Like we all have those people that we will say, I remember so and so. I'll call out someone, I'll remember always Tina, who, when I heard from my sister and as she was going through her cancer journey, and she said, gosh, I don't know what I would do without Tina. It's like
Hmm.
those are those memorable moments.
Right.
And we look back at, you can't put a timestamp on those types of interactions. Those
That's
interactions need to take as long as they need to take because we have people we have to support through whatever journey they're going through.
right. Correct.
And that's what we want to create.
Absolutely. Very interesting because it's the moment that matters and that you want to focus on with the right set of technology that enhances this entire patient care. And that is truly the real value behind how actual patients feel cared, not just in a robotic way, in a human-like way, but at the same point having their time saved. It's a really fine balance that this focused on. That's really good. And at Dreamforce, as you mentioned a term, I really liked that it was about order-based scheduling in this. If you could shine a little more light upon that, how are you envisioning order-based scheduling?
Sure. I think it goes back to those orders such as breast cancer screenings, your mammograms, your colorectal cancer screenings, all of those that we know that as we hit certain ages, we now become eligible for certain exams.
Hmm.
And I would even say that it's the exams that are covered benefits by our health plans that we're not taking advantage of. So being able to, again, automate some of these and leverage through the technology the ability to create a call to action to the patient,
Hmm.
whether that is before or after they've contacted us,
Right, right.
while they're contacting us,
Hmm.
to be able to give that time back to explain what the benefits are for this patient, meaning this is a covered benefit. This is not something that you need to pay out of pocket for. And here the order's already been placed for you. I
Nice.
can go ahead and schedule it for you now,
Again, closing the quality gap with this though. Absolutely.
closing the loop every single time.
Yep. And something that, a challenge that standard healthcare insurance providers face as well, because they want to close the quality gap at any point, and these kind of missing data points and workflows hinder them to do so. And it's always a very interesting challenge to solve because at the end, the goal is the same, to provide as much better patient care as possible. That's the point. And what I always love asking as one of my ending questions is always a bold prediction you would like to make for the year 2030, with not just with your mission, but how you see the automated connection center space for a better patient care enhancement. How do you see it? How do you see an ideal day looking like in 2030 for it?
Gosh, I think an ideal day, that's not that far away, 2030,
Mm.
is one where we really can support every patient at every point of their journey in a way that they feel known and cared for, whether that be the ability to chat, engage through an AI solution, or being able to know that because we've created all of these optimization opportunities, we've leveraged all of these optimization opportunities, the person that still wants to be able to pick up the phone and talk to somebody can get to them even faster and even sooner
Mm.
because we've taken off all of this excess administrative burden from their
Right,
plate.
right.
Um, I think one of the things that I'm looking forward to the most in the coming years for us is our ability to turn on video triage, be able to bring back the human interaction, even if it is through a screen. I'm looking forward to the day that I call and I say, I do want to speak to Joey or Sally at
Hmm.
the Connection Center via video to create that human interaction that I think
Absolutely.
our remote workforce is missing. When we see that people are ready to go back to an in-person setting, can we create that while still being in our communities, while still keeping our work local, but be able to engage on a human aspect?
Excellent. Very nicely put. This kind of answers the next thing I had in mind as well, regarding how much important human aspect is in this all automation world. Because you can't really take that out of the picture when it comes to caring for patients. It has a big mental element involved in it, and of course, machines can't be taking care of that. Yes, they can facilitate you in accelerating it. That's what it's all about, and then you helping the patient make the right decisions. That's it.
I think you said it right there. Our ability to accelerate the work that needs to get done and
Hmm.
how we want to continue to do it.
Yeah.
We're certainly on that path right now.
Absolutely. Let humans do what they're good at, be humans, and let machines just assist them in taking better care of those patients. That's what I always like to believe in that. That's good.
Correct.
That's great. Yeah. Any other question you may want to ask Cecilio?
No, I think I'm done.
Excellent, excellent. This has been wonderful, Celio. I once again thank you so much for your time. The insights and expertise are phenomenal. We'd love to post this on our socials. We'll create some awesome clips from this, share it with the community and all that. Would love it if you would reshare as well. And I'm sure this is gonna help out a lot of the audience that we're gonna have, and get some good feedback. And I really look forward to staying in touch with you.
Likewise, sir. Likewise.
Thank you so much, Cecilio. You have a great rest of the week.
You too.
All right. Thank you.
Bye-bye.